The following tests should be used for the diagnosis of Cushing syndrome. 24-hour urine free cortisol or UFC, late night salivary cortisol, and or a low-dose dexamethasone suppression test. None of these tests has 100% diagnostic accuracy. Each test has its own caveats, and multiple tests are usually needed to establish the diagnosis. The 24-hour urinary cortisol test measures the amount of cortisol being produced within the urine over the course of an entire day. Levels higher than 50 to 100 micrograms per day in an adult suggest the presence of Cushing syndrome. The low-dose dexamethasone suppression test measures the response of the adrenal glands to ACTH. It involves taking a small dose of a cortisol-like drug, dexamethasone, at 11 p.m., then having blood drawn to screen for cortisol the following morning. In patients without Cushing syndrome, the morning level of cortisol is typically very low, indicating that ACTH secretion is suppressed by the evening dose of dexamethasone. In patients with Cushing syndrome, the morning cortisol level will be high. It is evident that normal patients will suppress their cortisol to a very low level, whereas those suffering from Cushing syndrome will not. The late night salivary cortisol test is a relatively new test that checks for elevated levels of cortisol in the saliva between 11 p.m. and midnight. Cortisol secretion is usually very low late at night, but in patients with Cushing syndrome, the level will always be elevated during this time. After a definitive diagnosis has been made, the source must then be determined. The first step in distinguishing the underlying cause is the measurement of ACTH. Patients with ACTH secreting tumors will either have a normal or elevated level of ACTH. In contrast, patients with an excess of adrenal cortisol will have a subnormal level. MRI of the pituitary gland with gadolinium enhancement is recommended approach. When an obvious pituitary tumor is identified with an MRI, further diagnostic evaluation may not be needed depending on the clinical presentation. However, about 50% of patients will have a normal MRI of the pituitary, with 10% having incidental tumors unrelated to ACTH production. In such cases, the MRI will not provide a definitive diagnosis and additional tests will be required. Petrosal sinus sampling is a test used to distinguish the source of ACTH secretion and should only be performed after the diagnosis of Cushing syndrome has been confirmed. ACTH and other pituitary hormones produced in the pituitary gland enter the bloodstream by drainage through veins called the inferior petrosal sinuses. To perform this procedure, a catheter is placed in both veins at the same time and blood is sampled for ACTH before and after the administration of the corticotropin releasing hormone and at 2, 5, and 10-minute intervals. When administered correctly, this test should provide an estimated 95 to 98% diagnostic accuracy rate.